Hello, and welcome to another edition of Exclusive Interview, coming to you from the studios of 84 TV Radio, Abuja, Nigeria. My name is Stanley Bentu. Now, toward the end of the year 2020, after experiencing, several months of lowering numbers of COVID-19 infections, the numbers in Nigeria began to rise again. Now, the NCDC and the Presidential Task Force on COVID-19 announced that Nigeria was indeed in a second wave. But what is responsible for this? How can we tackle it? What about the changing attitudes towards non-pharmaceutical preventive measures? Well, that's what we'd like to talk about today. But before we do that, have a look at this report.
Like many countries all over the world, Nigeria entered a second wave of coronavirus infections in the later part of December 2020. The number of COVID-19 cases detected in the country surpassed the 100,000 mark in January of 2021. Bas Mustafa, Secretary to the Government of the Federation and Chairman of the Presidential Task Force on COVID-19, stressed that the country is at risk of losing not only the gains from the hard work of the last 10 months, but also the lives of citizens. Since then, the death toll has significantly increased. There is hope offered by the arrival of vaccines, but it is still some time away before Nigerians will have the shots in their arms. This is the new challenge for Nigeria. The COVID-19 pandemic also reopens a conversation about an age-old problem faced by this nation, financing healthcare. There is high reliance on out-of-pocket health payment as a means of financing the health system in Nigeria. This has continued for many years in spite of a general consensus to move closer to universal health coverage and sustain it when achieved. Out-of-pocket health payments can make households face catastrophe and become impoverished. According to the World Bank, out-of-pocket payments for health services determine whether a household would end up being poor or not. Communities from all over the world experience catastrophic health payments, but people in low-income countries are mostly affected. The World Health Organization estimates that globally, over 150 million people incur catastrophic health expenditure, while over 100 million are pushed into poverty due to OOP health payments. Most low and middle income countries, including Nigeria, are battling the problem of poverty. Financial protection ensures the households do not face financial hardship and become impoverished as a result of seeking health care. In an attempt to address the lack of financial risks protection, the federal government of Nigeria in 2005 kickstarted the National Health Insurance Scheme, NHIS, with the aim of providing access to good health services and also ensuring the protection of households from the financial burden of OOP health payments. Over decades, evidence suggests that less than 5% of Nigerians, mainly federal government workers, are insured under this scheme. On this edition of Exclusive Interview, we speak to the Managing Director of Nigeria Health Watch, Vivian Ihekwazu, a health communication advocate who is responsible for designing and implementing health advocacy strategies and campaigns for government, not-for-profits, and development partners in Nigeria to raise the profile of health issues. She has an extensive international portfolio and strategic communications with 20 years experience working as global media communication and research agencies in the UK, South Africa, and Nigeria. Her work currently focuses on nutrition, maternal, newborn, and child health, immunization, sexual and reproductive health, and epidemic preparedness. She breaks down why it is essential to ensure that Nigerians are not one illness away from bankruptcy.
Welcome back. I'm now joined in the studio by the Managing Director of Nigeria Health Watch, Vivian Ihekwazu. It's a pleasure to have you here.
Good afternoon, Stanley. It's good to be here too.
Well, Since the latter part of the year 2020, Nigeria suffered a relapse as far as the pandemic is concerned. What exactly is responsible for that?
Okay, thank you for that question. I think since the beginning of the outbreak in February 2020, the country was suffering from the pandemic like most of the world. Mm-hmm. And, since then, our lives have been changed in so many different ways. As Nigerians, we're social beings. We're used to going out, earning a living. But following the pandemic, we've all had to readjust and change our lives. Mm-hmm. And we've all been introduced to public health measures that are not instinctively natural to us. Distancing, face masks, hand washing frequently, although hand washing should be frequent. So I think towards the end of the year, it's a festive period. And Nigerians are used to going out, socializing, coming together as family, as friends. And we were almost warned that we need to still be on our guard, that the pandemic is still with us, to take all the necessary preventive measures and not to forget that COVID is still here. And the Nigeria Center for Disease Control had their Celebrate Responsibly campaign and reminding people of what to do. However, that was one of the periods of the year when people came together. Prior to that, people had stayed in their individual bubbles, within communities, within families. And suddenly you had people all coming together and mixing. And also interstate travel, visiting friends, visiting families.
Oh, there was a large increase in that. A lot of people were traveling.
And so because of that, unfortunately, we had a lot of people mixing. And let's not forget our diaspora. In Nigeria, we have family, friends all over the world. And people have not been able to travel back and see friends and family. So we had travelers come in. So a lot of that mixing is really what led to the upsurge in cases in Nigeria and in other countries, in Africa and in Europe and the US, as we have all observed.
So is there anything that we possibly could have done to have avoided or averted a second wave of the pandemic?
The simplest thing that we could have done to avert the second wave or an upsurge in cases is sticking to those public health measures we were talking about, which is not mixing, which is staying away from large crowds, not going to parties. December, many people got married. So we were told not to congregate in large gatherings.
Mm-hmm. There were also a lot of funerals.
There were lots of funerals. Mm-hmm. Many families had traveled into the country to bury loved ones. So in terms of could we have done something, we could have if we had all adhered to the public health measures that we were all asked to.
Well, part of the problem would be, as you mentioned earlier, that these are things that don't come naturally for humans. We're very social creatures. And there is also fatigue, because the message that was coming during the first wave was, oh, well, we don't know anything about this virus. We don't know how long it's going to be. We don't know. So the impression now becomes, okay, this is going to be a new normal, if you like. And that word or that expression was used quite often. Do you think that led to some kind of fatigue? Like you reach a point where a person just says, look, I'm tired. I just can't do this. I'm going to take my chances.
Absolutely. I think towards the end of the year, people had become tired of having to adhere to those public health measures, assuming that they were adhering to them in the first place. Let me say assuming, because one thing we are aware of is there is still, up to today, quite a large section of our Nigerian society that are very skeptical of the existence of COVID. A lot of risk communications has been done by NCDC, National Nutrition Agency, and all the government parastatals in reminding Nigerians to adhere to public health measures. But what we've observed is when people are looking at the number of cases reported on a daily basis, they look in them and say, is there really such a thing as COVID? Especially, let's face it, in states that are not testing adequately. The COVID response, it's not just a federal effort, it's a state effort. So where you don't have states that are testing adequately and they're not reporting large numbers, people are now looking at those and saying, is this what you're talking about, COVID? Are we even sure it even exists? Because there is a perception, and in the work we've done, we did a lot of radio as part of the work we do at Nigeria Health Watch, engaging with people on the state level. And so with radio, you have that two-way communication with people calling in and asking questions. And, you know, you hear skepticism of the existence of COVID. And also people actually say that, oh, COVID is a Lagos or an Abuja thing. For the reason that you see larger numbers of cases reported, especially in Lagos, where they are now, especially now, more actively testing.
It's because they're testing more.
They're testing
and that's
more,
why they're finding more cases.
So the simple thing is, if you don't test, you don't find. And if you don't find, then there's an assumption it doesn't exist. But we know that's not the case. The second wave has shown that we are absolutely reporting a much larger number of cases. Sadly, we now are at over 110,000 COVID reported cases and just under 1,500 reported deaths.
And doing over 1,000 every day.
Every day. And this only, I think the first day we reported a sudden upsurge was around, I think, 17th of December or so, where suddenly we had way over 1,500 cases reported on a single day. And prior to that, we weren't really hitting even up to 500 cases. So there was a perception that COVID is not really with us. But I think since December, with the upsurge in cases, we are definitely seeing a lot more confirmed cases, averaging a nothing less than 1,000 every single day.
Speaking about attitudes, you know, on the one hand, you have those who are saying this doesn't exist as some sort of scam, or the government is using this as a way of, you know, getting money from the World Bank and the IMF and all of that. But then there is this other group that says, okay, yes, it is real, but Nigerians have proved resilient. I mean, I remember at the beginning, people thought that, you know, our health care system was going to be overwhelmed. We were going to see bodies lined up on the street, especially after the comments attributed to Mrs. Gates. And that didn't happen. And so, you know, maybe people are getting a bit complacent and feeling, okay, we can beat this even by our natural immune system. But before you answer that, I mean, is there any explanation? Do Nigerians have, or maybe sub-Saharan Africans, do they have any kind of resilience against COVID?
I think, you know, COVID has been with us for less than a year, and I think time will tell. Because one thing that was for sure, people in Europe and the US looked at Africa and said that we don't have as many cases as they thought we would. As you quite rightly said, there was a perception at the very beginning that our healthcare system was going to be overwhelmed with the onset of COVID. I'd say for Nigeria specifically, what happened early on is the government, to their credit, was quite fast in putting in a lot of measures that stemmed a sudden upsurge. You'll remember back in March, we closed our borders just after we reported our first case. And that very quick response actually did stem an upsurge in the country. But subsequent to that, we had our lockdown, which was a good way, and many countries instituted similar measures to keep people apart and to protect the health system. And we saw in places like in Italy, during our lockdown, there were thousands of people dying every day, and the healthcare system did become overwhelmed.
That's right.
But ours didn't, because we had locked down quickly. And also, let's look at the country as a whole. The transport links into Nigeria are not as much as other European countries. So we didn't have that huge number of people coming into the country, whilst we do have a lot of international travelers. So a lot of those early measures did protect us a bit from having an upsurge in cases, but subsequent to that, with people going back to work, people mixing a lot more, we did slowly start having a lot more community spread. And once that happens, unless people are adhering to the public health measures they're asked to, we've seen it in many other countries in the world. We're not unique in this. Human behavior is human behavior. We are used to going out. Face masks are alien to us. So we all had to learn to live in this, you know, you mentioned it, new normal, which, you know, as much as we hope, life won't go back to the way it used to be. We have to now learn to mitigate the risks in our lives, but continue living, but with the knowledge that we have this virus, which is still raging.
It's still raging now, even though we do have vaccines, but there are lots of challenges where vaccines are concerned. And I want to get to that, but before I do, what more can we tell Nigerians? Because they're at the point now where you hear a lot of people say, look, yes, I know it's there, I know it's risky, but I'm facing issues and problems that are far bigger than this, so you know what, I just don't care.
Yeah. I think, human behavior, you're going to weigh your risk with your reward. Your reward is if you go out, you're going to earn a living. The risk is if you get sick, you may die. So people are almost weighing up this risk and thinking, you know what, this COVID thing, there are other ailments in this country that are killing more people. If I don't go to work or earn a living, I could actually die of hunger. So there was a lot of that, especially during the lockdown, where people thought, I'd rather die of hunger than die of this thing called COVID, where I don't see people dying on the streets.
This is why the government is reluctant to.
And yes, and because
down,
you have to really weigh up, when we say lives and livelihoods, the lives you're going to save are people who might catch COVID. Livelihoods is the impact it has on the economy. So people look at those two things and think, I have to get on with my life. And also we've had schools opening, and that's been a very difficult decision in the sense that do you keep kids away from school or do you open schools? But within that parameter, mitigate the risks. So if you're going to open a school, there is a lot of responsibility at the state level to ensure that kids are protected in schools. And the responsibility lies with the parents. When you're sending your child to school, if, for instance, you come from a family where no one believes in COVID, so the family don't wear masks or any of that, then you're going to send your child into an environment where they're now having to adhere to these public health measures. Is that child going to follow it? And even when you get to the school, is the school ensuring that the children adhere to those public health measures in terms of making sure there are adequate facilities to wash their hands? Are they wearing masks? Are you keeping the children apart when they're in the classroom? We all know that in our public schooling system, we have challenges of overcrowding. So I think we're all having to think smart. How can we mitigate the risks but continue living? And it's a tough decision.
It's a tough call.
Yeah.
Well, we'll have to take a break right now, but when we come back, we'll be talking more about the big conversation related to vaccines and also paying for health care. How well can we do that right here in Nigeria? Don't go away. We'll be right back.
This question is a little bit hard to answer. As an individual, on my own, I won't take. But based on the recommendation of the government, if government certified that it's okay for citizens to take and it passed through necessary tests from certified agencies of government, it's good to go.
I will not take the vaccine because of the things we have heard about it, especially from my spiritual father that have said something about it, and from the things we have heard concerning that this is another satanic agenda that even want to penetrate into the lives of the people through that means, and that's the reason why I will not take it.
So the welcome of this vaccine to Nigeria, I think it's welcome. I support it. So the prevention is better than cure. If you say something is happening, vaccine in COVID-19 in Europe, and we know we don't have it in Nigeria, at the same time again, we can still go on the vaccine ourselves in Nigeria so that we can be in a safe side. I think it's a good omen to Nigeria.
I don't know, it depends. It depends. If it comes, and I'll first wait for people to first try it out. And if it does not have any reaction or anything, and then it's fine, since it's a vaccine, it's supposed to help out. So I think, and it's also going to help the scientists. If the first vaccine does not work out, then they'll try better ones that are going to help out. So I think it's helping the scientists out to be able to curb this pandemic that is happening. So I think it's actually a good thing. I am going to try it out.
Yeah, that question is controversial too, because our government, the way they behave, the whole issue surrounding the COVID-19 thing, for people to take it, for example myself, for me to take it, I must see the top government officials take it first. And we see within 6 months how he reacts on them. If it is okay, then it's good and it's fine by me, then I will go and take it. But if they refuse to take it first, pushing it to the masses to take, why they relax, maybe go abroad, take the better ones there, and now give us the ones who don't know how they've stored it, for how long they've stored the vaccine, you're bringing it for us to use, then I will not take. Until I see them take it first, after 6 months, we'll see how it reacts on them, then before I take.
I don't have any COVID-19, but I urge everyone that affected that since it's Nigerian government approval, then they should take it, they should accept it.
Of course, if it can solve the problem, I can take it. Like 2 or 3 people might have taken it then before it will reach every other person.
Welcome back to Exclusive Interview. I'm still here with Vivian Ihekwazu, and we've been talking about the second wave of coronavirus infections. Numbers are going up here in Nigeria, and right before the break we were talking about school children, getting children back to school. Some parents still skeptical, others, well, they feel this is something that should have been done a long time ago and are looking at the impact that the lockdown has had on their children's education. So these are tough decisions. How hard is it to have this kind of conversation with people who have very strong cases, both for and against, living up to the non-pharmaceutical approaches to prevention of the spread?
I think you touched on schools, and I'll go back to schools, because schools is a very emotive subject, because you're talking about children. One thing we've seen is that children are not as affected by COVID when they catch it, and there aren't as many instances of COVID in children. However, the challenge with children is children often could be asymptomatic in that they may have COVID, but they don't show the signs of it, or they're not severely ill. And they now go home and their parents get sick. I think this is the
or their grandparents.
Or their grandparents.
So they become walking weapons.
Because we know that as a society we live in multi-generational homes. So I think that is often people focus more on the child getting sick and forgetting about the other people that they could potentially infect. But it's a difficult decision, and we keep on saying how difficult it is, because it is. Keeping children at home, we have to be realistic of the realities of our country. Nigeria has one of the highest number of out-of-school children, which already puts us on the back foot in terms of pushing our country forward and improving the educational outcomes of our children. So we're already on that place where we need to be improving education outcomes of children. On top of it, you now have COVID. So if kids are kept out of school, let's think 2, 3, 5, 10 years ahead. What impact is that now going to have on the future generation? These are decisions we have to think about now, which is why when you listen to the Presidential Task Force, one thing they always emphasize, it's a collective responsibility. Let me give you an example. If you are going to work, or you're going to shopping or wherever, and you get on a bus, and there's a school child, and there's a child in that bus, you're not wearing a mask, how are you helping in keeping that child safe and others around you? So it's a collective effort. So both in the homes, in society as a whole, and within schools, mitigating those risks that continue to add to the spread of COVID-19. So yes, it's a difficult one.
It's really difficult. I mean, I know just this Christmas I traveled home. I was one of those traveling Nigerians.
Many did,
and
yes.
My mother is old. She's over 80, and not been feeling well lately. And it was difficult having to visit with her and not being able to come close to her.
Exactly.
And of course, she saw me. She wanted to give me a big hug, and I kept on resisting. She didn't mind. She didn't care, but I knew that, okay, in my line of work, I'm almost like a health worker.
Yes.
High risk. So, just being safe and trying to stay away from her. And it was a difficult thing, to see a close relative like that and not being able to relate normally, especially when in their condition they don't really understand why you have to stay away. So I can understand why lots of Nigerians are frustrated. It's a difficult situation. But moving ahead from that, there's light at the end of the tunnel. We now have these vaccines coming out, these days even thick and fast. But attitudes, again, are a major challenge. I've seen lots of things that have been shared. Videos have been shared about, don't take the vaccine. They want to wipe out our populations. And is there any... This is the 21st century. Is it possible for a compound to be placed in a substance that cannot be or would not be discovered by the health experts in a particular country? Is that even possible?
In terms of vaccines that you mentioned, we've been told, or we know from the onset, that vaccines have been are one of the biggest inventions that has changed the health outcomes of populations. We must think back at polio, for example, that Nigeria was finally certified polio-free 2020, literally, by the WHO. And we're very fortunate because we were the only African country that had polio. So I think we need to look back on our history and understand the role of vaccines. Smallpox was eradicated in the 1970s. It was killing millions of populations. So COVID-19, we were told, or we know from the beginning, that vaccines are our only way out. However, add to that, historically it's taken not less than 10 years to discover vaccines. And suddenly we have a vaccine in less than a year. That has led to a lot of skepticism at the safety of the vaccines. How can it be that suddenly we have a vaccine in less than 10 years as we are used to? I think what people have not fully understood is that prior to the discovery of these vaccines, a lot of previous work had already been done. So the the technology that was used to develop these vaccines at this speed, there was a lot of prior work that had already gone into it. So the vaccine development is absolutely phenomenal. That has taken less than a year, but a lot of that is credit to science and research that was done in a lot of developed countries, that has led to the fast development of the vaccine. I mean, as a continent and as a country, these are things we need to really critically look at ourselves, at how much are we investing in science research. But that's part of a larger discussion, which we really, I think the pandemic has really shown us that our internal health security is dependent on our ability to protect ourselves. But, as we know, that's something that we have to really think forward as we go. But in terms of vaccine safety, there are 3 vaccines so far that are being deployed in many countries around the world. We haven't yet had vaccines in Nigeria that have got WHO approval, but we know that we will be getting those vaccines at some point. The vaccine safety has been central to the approval process. Any vaccine that's used has to be WHO certified, and until those processes are done, no country will roll out vaccines in their country. So top of mind in any vaccine that's used, for instance, in the UK or the US or any other country that's rolling out vaccines, is safety. So NPHCDA, the National Primary Healthcare Development Agency, who is responsible for the vaccine program in Nigeria and was successful in the polio eradication, have expertise already in rolling out vaccine distribution and making sure it gets to the right people in Nigeria. I think the unique thing about COVID is this is probably the first time in history almost that vaccines are going to be distributed to a larger population, because you'll know that previous immunization programs are usually targeting children. So this one is specific in that, it's different, should I say, in that it's targeting a much larger population. And it's not going to be a straightforward process. And
I imagine they will probably target the most vulnerable groups, especially since a lot of our cases are asymptomatic. So maybe you want to look at the elderly, the health workers first before the rest of the general public. Would Nigeria be looking at an approach like that?
Yes.
A good way to do it?
I think most countries have followed the WHO recommended distribution framework, which prioritizes health workers, then the more vulnerable over 70. And the reason why health workers are prioritized is these are frontline. It's almost like you're fighting a war, and these are your soldiers.
You're in the trenches.
Literally. And you have to make sure that they are the ones who are well equipped and are protected, because if anything happens to them, then none of us are safe. So health workers are the top priority for vaccines, as you will see in other countries that are already getting their vaccines. Subsequent to that, you're looking at the population that is most susceptible to dying, not getting it, because if you look at the number of cases we have in Nigeria, it's actually a much younger population that gets COVID, but they tend to recover. But the people dying, unfortunately, tend to be the over 50 plus, and also people who have prior medical conditions, high blood pressure, diabetes, asthma. So these are also a priority group. But currently in Nigeria, they are, MPHCD has stated that the priority groups will be health workers and then the vulnerable population over 60 or so, 50, 60 or so.
All right, moving on from coronavirus and the pandemic, healthcare in general has been a point of interest for me. I don't think that we consider it as much a political issue as it should. I think that anyone running for office, whether it's local, state, or federal level, should have a big conversation about providing healthcare. I read somewhere something that was so profound that it's haunted me almost every night, that if you are even an upper middle class to lower class Nigerian, you are one serious illness away from bankruptcy. And why this became so profound for me is I've seen the number of people who are either rich and famous, and at the end of the day, there is some sort of fundraiser going on social media because they have some serious condition, cancer or something like that, or some sort of kidney problem. So this means that there is something very wrong with the way we operate our healthcare system and how we pay for healthcare, and this places our entire population in very grave danger. So let's look at health insurance and some of the ways that we pay for health. What are your views on those?
I think what you will see in terms of health financing, it's a critical issue we have in the country, because we know, and there has been prolonged evidence, that our healthcare system is significantly and severely underfunded. In 2001, Nigeria was one of the many African countries that pledged to spend at least 15% of our GDP on healthcare. To date, we haven't spent more than 5%. Our budget was just passed in December, and if I recall, we are spending this year, 2021, just over 4% on our budget on healthcare. It's a bit disappointing, actually, because the COVID-19 pandemic has literally shown us that without health we have nothing. We haven't got an economy. Because of the COVID pandemic, we've had to close down our economy, and it has devastated it. So we are very vulnerable. So our healthcare spending is significantly less than it should, given we have a population of over 200 million. Now, one thing that, as a country, we look to how other countries are funding our healthcare system. There is no way we can fund our healthcare system without some government co-payment, in as much as we have private health insurance. Because we have a lot of functional private health insurance companies that offer private health insurance, but to be honest, it only targets a very small percentage of the population, less than 5%. We have the National Health Insurance Scheme, which is supposed to now offer health insurance to a wider pool of Nigerians, but it only offers insurance to government officials, or people who work in ministries, or people who work in civil service.
So it's only covered 1%.
And it's covering such a small percentage of the country. So you mentioned what we call catastrophic payments. This is where one illness can literally devastate your entire family, because you're now having to raise funds to fund healthcare. So, we're looking to move to a place where we have adequate funding into the healthcare system, and look at how other countries have funded healthcare. For instance, the UK. They have the National Health Service. The National Health Service is funded by taxes. Our tax base in Nigeria is very low. To convince people to pay taxes, or to even ensure that companies, we have a very large informal sector in Nigeria, are paying taxes into the government coffers to protect and to provide for all these social services, education, health. We know that adequate funding is not coming into our tax base to fund healthcare. As a country, we've been dependent on oil revenue, and because of that, the government is not strictly accountable to the population, because you're not actually getting your revenue from the populace. So in terms of being accountable to them, you're not. I mentioned the National Health Service. It's funded through people's taxes. So the government is accountable to the people who are paying the taxes. So in that sense, you have a funded healthcare system that provides healthcare for everybody, irrespective of your ability to pay. The US has a more private health insurance focus, which you can see from the COVID-19 pandemic has devastated them more than it would if everybody had access to healthcare. So even in the US, you have people on low income who can't afford healthcare because there is no state-funded healthcare system. But in Nigeria, I think what people need to understand is health is very important. Nigeria Health was one of the things we advocate on is adequate funding for healthcare, and for people to also prioritize healthcare when you're looking to vote for somebody. During the last elections, we did a survey across the country, looking at how people prioritize healthcare, whether it forms part of their decision in deciding who to vote for. And many Nigerians don't really think about healthcare when they're making a decision to vote. Elections in Nigeria are not won or lost on the health policy of a specific political party. So I think until we get to that point where health is prioritized more, we're not going to get that demand from the government to invest more in healthcare. Having said that, one thing I think that's changing is every state has now got to implement a state health insurance scheme. And this, if successfully implemented across the different states in Nigeria, will bring additional revenue into the healthcare system. That's one. And then in 2014, we had the National Health Act, which stipulated that there has to be a certain percentage of the Consolidated Revenue Fund from the government now going into healthcare. That was actually passed about 2 years ago. The Basic Healthcare Provision Fund will now be used to bring additional funding into the healthcare system. And what this will do, it would now offer a basic minimum package of health services to people at low income levels. And if all these policies are adequately implemented and the funds are not just allocated but released, we should slowly have more money come into the health system. But at the same time, we need Nigerians to demand for better healthcare.
So it's up to us.
It's a two-way thing, but we have to Nigerians have to know that they have a right to better healthcare.
Wow. We'll have to leave it there, but it's been such a pleasure hosting you and a very interesting conversation.
Thank you very much, Stanley. It's a pleasure to be here.
Don't go away. We will be right back.
I've heard of it, but I haven't seen any. Though I visit hospitals to visit the sick people, but I have never heard of anything like that.
The situation of Nigeria these days is unbearable. And many people are being a victim or being victim for that circumstance. I want to give you a brief history or what I've encountered, what I've seen so far from someone. What happened is the person was admitted in the hospital, and this thing happened in Enugu State, because I am from Delta, but I worked in Enugu. So what happened is this woman was admitted, and because of the condition of Nigeria, she was unable to pay up her bill, hospital bill. The doctor came. I was a witness because I was there in the hospital. So the doctor came and then gave the woman the bill. The woman delivered. And there were two twins. So when the man, that is the person that, the husband to the woman, was unable to pay the bill, so the man ran away. So it was the woman that the doctor met and told the woman that, look, your husband has run. What next? This is your bill, and your bill is about 170,000 naira. So the woman could not pay. She even went begging other people, her relations. They couldn't come up. I think she was able to get up to 70,000 out of the 100 and something. So the whole thing happened in such a way that the doctor asked her to stay back and serve the hospital for some period before she would be released from the hospital. And that was what she did.
A very insightful conversation we had with Vivian Ihekwazu, the Managing Director of Nigeria Health Watch. I want to talk about health in Nigeria. Do we consider it serious enough of a political issue that we are willing to hold up our leaders to account. If someone comes to your neighborhood and says, I want to become a councillor, a governor, a president, one of the first things you should ask is, what are you going to do to help me live my life to the fullest? And that means to have not only food, clothing, and shelter, but to have good health so that we can accomplish our dreams. Without health, there's really not much else that we can do. If you've been to a general hospital and looked into the eyes and the faces of people who are struggling with terminal illnesses, you realize that they really don't care much about the economy or new clothes or Christmas. They just want to get well. So health is very important. In fact, some people would say that is wealth. So we have to do something about it as citizens of the Federal Republic of Nigeria. We have to make sure that the government makes a bigger investment in healthcare and make sure that everyone has access to that. Well, that's it on Exclusive Interview for this episode. Join us again next time. Until then, thank you for stopping by.